Dr. Meyer's Wellness Wednesdays. And we are so pleased to have with us Dr. Bradley Meyer from the Okoboji Wellness Clinic. Look forward to these Wellness Wednesdays. Good morning, Dr. Meyer.
Good morning. Grateful to be with you, Dave, and everybody listening this morning.
Going to talk about pain today.
You know, we've touched on it a few times, but I was coming across a clip from a fellow friend and doctor of mine talking about pain, and boy, did it resonate with me yesterday, and my evolution in this pain journey, because pain can be one of the most frustrating things when it comes to a doctor to manage, but it also can be one of the most rewarding, because if you can fix it, that has got such an impact on so many different things, from psyche, mental health to physical health, that if you can crack the code on that, it's a big, big deal. And what I've found is that typically with pain, many times, again, like a lot of the pharmaceutical approach, you're happy in those situations when sometimes you may need something that might be a prescription, but many times when it comes to management of chronic pain, those prescriptions really are, sometimes the medications have side effects, and sometimes they will not fully have as much impact as we hope for managing the patient's quality of life and pain symptoms.
Yeah, so what's really cool is you have found that circulation and the ability to aid circulation to these pain areas can offer dramatic results.
Absolutely, and that's getting to more of that root cause level when it comes to pain. Let's take, for example, a back, and say that there's a pinched nerve in the back, the spinal cord's pinched, which we call spinal stenosis, or there's a herniated disc, or a slip disc that's pinching a nerve. Well, in cases like that, in any pain condition, if you can get the nutrients and support to that injured tissue, the body can go into an incredible process of healing. And so really giving the body what it needs, and what it's missing is it's the circulation factor. So many times the oxygen and the contents in our blood that feeds a healing process, sometimes it's nutrients like B vitamins, for instance, minerals. If you can't get the supply, it'd be like during World War II and the supply lanes and over in Europe, and how they would try to block those supply chains to starve out the troops. Well, it's the same thing that happens with chronic pain, acute pain, is that supply line of helpers is blocked. Mm-hmm. And so that the main driver of that, of course, we think of is oxygen, but there are other nutrients in addition to oxygen that help impact that circulation in a big way. So start to take away some of that swelling and stimulate stem cells in the tissue, and do some of those dramatic things that help the body again get back onto even playing field. So the big thing, however, is it's in the treatment specifically. Again, lots of fun to treat pain right now for me, because there are many, many cases that I'm going to be able to impact, and we as a team here at Okoboji Wellness Clinic are going to be able to impact in a big way from a pain perspective.
Well, I want to get to the patient that came to see you, because this is remarkable. A surgery candidate turned away from surgery because of a medical condition. Tell this story, because it's remarkable.
Right. So a lot of times we'll have folks that have tried things. They've tried physical therapy, which is supremely important, very helpful. They've tried pharmaceuticals, and maybe ablations or epidurals. or they're looking at surgery. And in some cases, every surgery there carries a risk. There can be a benefit too, but many of my folks are coming in saying, well, I'd like to try everything possible to delay that if possible, or to make it so I don't need to have it at all. And so this gal coming from Southeast Iowa, she had developed some significant low back pain to the point where it was disabling. She could barely move in the mornings. She was so stiff. And she had an evaluation that noted, she had a pinched spinal cord and a nerve that was getting pinched by a slipped disc in the low back. And it just happened so that her blood count went down for other reasons and was anemic, so she was not going to be a candidate for the surgery. She came up to the clinic, and we've been working together on managing her care, and pain was one of the big things that we addressed first. And, you always wonder, it's like, wow, if you've got some significant advanced pathology, you're talking a pinching of the spinal cord and a slipped disc, how much impact could another injection have? Because many times they've tried, again, epidurals and nerve ablations or what have you. But this is where this prolozome, which it's utilizing ozone, which is 3 oxygen molecules together. So we have an ozone generator that will split the oxygen, and in a very temporary amount of time, it'll create ozone. And so within a certain amount of time, I will place this ozone into the area that has poor circulation. And the cool thing about it is you can go up wherever there's pain. There's pretty much not many places, if any, you can't go with ozone to address pain. And so we said with her, I said, the first time she came up, I want you to think about it. I don't want you to rush into anything. And she did. She came back, and we tried it the first time. And one of her local doctors was not convinced. Didn't have much information or prior education on ozone, and didn't think that there was going to be much movement with regard to progress with her. And she came back a week later and shared with me dramatic improvement. I think she said 75% improvement in her symptoms after the one injection. And sometimes, with a chronic situation, sometimes we need a series of injections, maybe 3 to 6 or 7. But she was absolutely floored. She went back to that provider, and the provider did a physical exam and was absolutely astounded and said, "Wow, okay, I didn't think that was gonna have such an impact. I want to learn more about this." And so her case, again, whether it's doing hyperbaric therapy or many times we do PEMF, red light, this makes it so much fun when we have all these tools to have a dramatic impact on somebody's daily life. Again, my days now, many of them are filled up with doing these prolozone injections. And again, it's so rewarding because folks that may have had pain for 20 or 30 years or beyond may be able to find some relief when we help, again, restore this circulation. And that's doing this prolozone blend, which has some B vitamins in it and a couple other things. And then you throw in some ozone gas. And it's about a 5 to 10 minute treatment. Very simple, very easy. Do it right in the office, and it's extremely low risk and very much a high reward with regard to. Again, I would say probably about 95% would be about the amount of folks that I've seen respond to it. Well, maybe 97.
That's incredible.
It's incredible. I mean, compared to the steroid injections that I used to do all the time, to have that level of response, and that's a grade from sometimes complete resolution of pain to, 25% to 75%, but when you're on that pain scale and you can make a significant impact in that when it's life limiting, you'll take that. But again, it's sometimes it literally, I cannot believe that it can bring a lot of folks close to zero pain. And so, it's shocking.
Well, and so again, and since we've actually, since the beginning, we've talked about getting to the root cause. And yes, there's definitely a need for Band-Aids. But one of the things that you do at Okoboji Wellness Clinic is try and get to the root cause, treat the root cause. It's so crazy, some of the things I run across. And I ran across this morning, and I don't ever know what you're going to talk about from week to week. But I ran across this, and it's from an MD that I follow and followed through COVID. And this is kind of lengthy, but I'll try and be quick. He says you're told just count calories. So you eat low-fat, high-carb garbage from the supermarket. Now you're hungry, tired, frustrated, and still fat. Pharma wins, you get a prescription. Your doctor says cut salt to lower blood pressure. So you throw out the salt shaker, but keep pounding sugar and carbs. Your blood pressure doesn't budge. Pharma wins. You stay on meds for life. Your dietitian tells you eat carbs with every meal to manage type 2 diabetes. You follow orders. Your blood sugar spikes. Your insulin climbs. Your meds increase. And you stay diabetic. Pharma wins. Another chronic patient locked in. You get the idea, you get the pattern. They're treating symptoms, but they're not getting to the root cause.
Yeah, I mean, a lot of times, again, the chronic disease, as I was traditionally trained, we really have fallen short on the nutrition side in the education of medical schools, as well as we do learn the pathophysiology, the anatomy, all of how things work. But in the process, we really get skewed towards, instead of, again, looking at pain as circulation, we just say, okay, well, here's some ibuprofen, and instead of looking at root cause. So, when there is a surgery that's needed or a bone that needs to be set or, there's an anaphylactic reaction that needs to go to the ER, I'm very grateful for all these doctors do, because you have to have all levels of care, in my opinion.
Mm-hmm.
And so and some folks prefer to stay on the pharmaceutical method and just lower the blood pressure and what have you through those means. But you should know that there are many more ways to approach care, and that's what we talk about. It's all about choices in education. If you want to get more on the prevention side, living with quality, maybe trying to reduce some of that pharmaceutical load. Again, 20 years ago, 10 years ago, even 5 years ago, many of us, myself included, didn't know there was another set of choices.
Right.
I honestly, again, that was the way I had been trained, and that's the case that our public has been trained, and so these alternative holistic routes are starting to get acclaim now and more attention over the course of the last 4 to 5 years, which, again, everybody wins in that case because it challenges dogma. It challenges, there may be some new approaches from my traditional colleagues that my patients bring to the table, and that's interesting.
Right.
And vice versa. Hopefully they're bringing some of this new stuff that we're doing here that's helping the body oxygenate, help with circulation, help with pain, and it's maybe piquing a little bit of interest. So it's again, we want more chips in the game, and so that's what we're doing. But your example, Dave, is absolutely correct, that you can get into this self-feeding. If you choose not to get into the root cause and try to work on some of the ways to break the cycle, the process kind of can feed itself in one solution might lead. It's like I always say, robbing Peter to pay Paul. One answer or direction might lead to another problem. And it's so interesting over time how the narrative on fat has changed, the narrative on alcohol has changed, on caffeine has changed, on sodium, on cholesterol, on statin drugs. I mean, you could go on down the list on everything and say both sides have been debated and now are being debated even more vociferously as you've got more doctors that are traditionally trained coming into this holistic realm that are kind of turning over rocks and saying, okay, hey, we need to look at this again. We need to look at, from a metabolic perspective, is high carb a good thing? These kinds of things. One thing I will say is that everybody is unique.
Yeah.
And so that's a lot of times the problem that we fall into is thinking the one size fits all. So there is no one perfect diet. There is no one specific way. There are infinite ways. The job on our part with the help of our guests is to find the way that's best for you.
Absolutely. And we talk about it all the time. We talk about living the day, not just surviving the day. But I just want to throw this one out there to challenge folks on how much things have changed. The incredible edible egg, bad, don't eat eggs, to now the incredible edible egg, you could live on eggs and maybe live the best life ever.
Yeah, just stay. It's like the Iowa weather. Stick around, and it's soon to change.
Yeah, so. Exactly. All right. So if folks want to come see you, that story is just amazing. That gal's pain and needing surgery, and prolozone does the job. That's just awesome. So, and we need to mention this real quick here. Folks can get in quick to get a prolozone shot. They're not going to have to wait forever, right?
Right. Yeah. If you're not wanting to take the long game just yet and looking at the entirety of your health, you're just wanting to focus first on that pain, you can just schedule an appointment with me. We'll review that pain history and with a little conversation, and then that same day we can get you going right with the prolozone. And then, if you decide you need a few more because it's helping, or my pain's good, and maybe the next step after that is digging deeper into your health history, that brain fog, the chronic fatigue, those kinds of things. But yes, you can just start with a call to the clinic to say, hey, I want to try this. I want to try the prolozone, and the gals can get you squared away, booked up. Otherwise, we do the discovery calls complimentary, which is about a 15-minute discussion with me, talking about a little bit of your health history, making sure you're a good fit, and the time is right for you to move forward with working with us at the clinic. You can give us a call at 712-339-6024. Again, this is a complimentary phone call. And then, for those of us that are ready to go right away, the team is ready to take appointments. And long appointment times. That first visit's typically an hour long, so we can cover a lot of ground and get into some really good history.
Very good. Doctor, always a pleasure. So cool to hear the success stories. Have a great day, and we'll chat again soon.
All right, be well.
Thank you. Dr. Bradley Meyer from the Okoboji Wellness Clinic. You can find out more, okobojivellnessclinic.com.